What's going on, guys? Tony Maritato here. So in this video, I want to talk about counting minutes, but more specifically, I want to talk about untimed codes. The initial evaluation for PT, OT, and a lot of SLP, these are untimed codes, right? So I'm a physical therapist. My initial evaluation codes are 97161, 97162, and 163. And then, of course, a reevaluation 97164. So these are untimed CPT codes. And it's important that we understand for proper billing how we count minutes between timed code and untimed codes. Now, this is a page from Novitas Solutions. I'll link to this page down below so you have this as a reference. But what I want you to see here is, of course, you know, most of us are familiar with the Medicare 8-minute rule. Most of us probably don't realize that we have to have an average of 15 minutes. So that means that if I bill 100 units of 97110 therapeutic exercise over the course of a year, some of those units can be 8-minute units, but if I do, then some of them have to be 22, 23-minute units as well. The average has to be 15 minutes. So don't fall into the trap of thinking, well, you can always just do an 8-minute unit because it's an average. So that being said, we have the chart here looking at 8 to 22 minutes for a single unit. Then of course it goes up from there. They have some examples. You know, you do 24 minutes of neuro re-ed, you do 23 minutes of therapeutic exercise, 47-minute total. You didn't cross the 53-minute barrier, so you cannot bill 4 units. You can only bill 3 units for that time. There's other examples, but like I said, my goal for this is talking specifically about untimed codes. So we can see here it says units for untimed codes are reported based on the number of times the procedure is performed, as described in the HCPCS code definition once per day. When reporting service units for codes where the procedure is not defined by a specific time frame, i.e. untimed codes, a 1 is entered in the unit field. This is the important part here. Note, the units for untimed codes are based upon the number of times the procedure is performed regardless of the number of minutes spent. The following examples of untimed codes: physical therapy evaluations, occupational therapy evaluations, re-evaluations, and then of course group therapy and supervised modalities. Reference is this policy manual, chapter 5, section 220. So we know that there is a face-to-face component to the initial evaluation, but what's important here is, do we need to count minutes toward that? And so when I gave an example of a 60-minute session in which a therapist might do, now I don't do this, full disclosure, I don't do this. I typically do 3 one-on-one direct supervision treatment units and 1 eval. Now, most of my evaluations are minimal complexity, 97161, minimal or low complexity. But I also collect a lot of my information before the patient arrives at my clinic. So I already have like the case history, I already have complexities and comorbidities, I already have medication lists, I already have a lot of that stuff. The difference is what I used to do 15, 20 years ago would be the patient schedules an initial evaluation. They arrive at my clinic. I have no context, no history, no background on this person. I spend 20, 25 minutes sitting in the exam room trying to collect this information for the first time. Now, currently, what I do is when I have time before the patient arrives, I call the patient. You know, if I have 5 minutes, 10 minutes between patient visits or before lunch or whenever, I just get on the phone, I call the patient. Hey, Nancy, this is Tony. I'm going to be the physical therapist working with you tomorrow during your initial evaluation. I just wanted to ask you a couple questions if you have 5 minutes. So tell me about what's going on, what makes it better, what makes it worse, I go through all of that in 5 to 10 minutes by phone. I put it all into my documentation system so that when I am face-to-face with my patient, typically what happens is treatment can begin. We might begin with therapeutic exercise, right? And a classic example would be yesterday, I did an evaluation for a new patient, status post total knee replacement. She was 17 days post-op. This was the initial evaluation. She came in with a cane, minimal pain. She was standing at the reception area, signing the initial paperwork, getting the copies of the insurance cards. So I go up, I introduce myself. Hey, patient, I talked to you on the phone yesterday. You look like you're doing amazing. Come on back. You can put your coat and your purse and everything here. I'm going to have you take a seat on this bench, and this is what we're going to start with. So we go right into the treatment, right? I start showing her how to do some soft tissue massage using a rolling pin to reduce some of the swelling and some of the thigh pain. While she's doing that, I'm also assessing. Now picture this, she's sitting on a bench back against the wall, surgical leg out in front of her if she's capable. In this case, she was. I'm assessing range of motion. I'm assessing swelling. I'm assessing skin color, temperature. I'm looking at the incision. Those are all components of the initial evaluation, but I'm also providing patient care, treatment, therapeutic exercise in this case, because that's going to be one of the home exercises, a self-massage with a rolling pin. So I'll do a minute of goniometric measurements to see where she is in terms of flexion and extension. That minute would technically apply to the evaluation, and it's face-to-face, but I don't have to track minutes for my evaluation, right? So if I did 16 minutes at the bench doing the terminal knee extension, the soft tissue massage, teaching them how to do it themselves, talking about alignment and ankle mobility, hip mobility, all of those things, one of those minutes might have been the goniometry. 15 of those minutes might have been the therapeutic exercise and the home exercise program. I'm going to document and bill 15 therapeutic exercise minutes during that 16-minute episode. And so the way I kind of break this out, hypothetically at least, is a person technically could do a 4-unit treatment plus an evaluation in 60 minutes.